Assalamu alaikum friends and viewers, it's me HAMZA AMJAD. Welcome back to my channel UOSPHARMAMEDICAL. So friends, most of the times you have seen someone suddenly falling down on the ground and lost consciousness. In that situation, what should we do? How can we save the life of a person? Is it safe for you and for that person? What is the technique or procedure to save the life, and how can we apply this technique? The answer of all these questions is in this video, so must watch the video till end. Actually, what happens when a person suffers cardiac arrest or cardiac attack, the blood will not circulate, heart stops to function and stops breathing, and also lose consciousness. Without oxygen being passed through the lungs to the bloodstream and then pumped around the body by the heart, the person will suffer irreparable brain and other vital organs damage, and he will die within a minute. To avoid such a situation, one must give immediate first aid attention, that is called CPR. CPR is a first aid technique that can save a person's life if applied correctly. CPR stands for cardiopulmonary resuscitation. We all should know this technique and apply it to save lives. We all have learned ABCD in our childhood, but in this video, we will discuss the doctor's ABCD. Now, how can we apply this technique? Let's have a look. D is for danger. At first, your safety is necessary, so before approaching to victim, you should look around carefully to make sure that the area is safe for you and for others. R for response. After approaching, shake the victim gently and ask a question to him. Are you alright? Wait for a moment. If there is no response from the victim, then you need S. Shout for help, as any assistance can be helpful to you. A for airway. Gently tilt the head back to the body to open up the airway so that there will be no restriction in the breathing. B for breathing. And for this, you need to look, listen and feel to sense the nature of normal breathing. Look for normal chest movements, listen normal breathing sounds and feel breath of victim against your face. And you should continue the process for no more 10 seconds. But if there is no sign of breathing or you feel breathing of an unusual type, then you need to start CPR. But first make sure that the ambulance is on the way, and if there is an assistant or friend with you, ask him to call and put the phone on speaker mode so that you can talk to the ambulance service. C is for circulation. Circulation of blood through the body. If the heart stops pumping the blood properly, you need to push on the chest hard and fast. Start by placing the heel of one hand at the center of person's chest and interlock your fingers like that. And now push the chest hard and fast and wait for a second and then push again with the same force. Fast means pushing 2 times in a second and hard means apply enough force that moves the chest 5 centimeters down. This is necessary to make the CPR effective. If you have proper training, you can give rescue breaths after every 30 compressions. This help provides some oxygen, but if you are not properly trained or not comfortable, carry on with the hands continuously compressing the chest. And if someone is with you, you can swap over and not stop compressing until the health professional takes over and the person is definitely breathing normal. And the last step is D. D is for defibrillation, which is applied to give a shock to restart the heartbeat. We can use automatic machine, that is AED, automatic external defibrillator. This machine will decide what to do. If AED is not easily available, you can carry on with the chest compressions, mean CPR, until the ambulance is arrived. Performing CPR on a heart attack victim that is not breathing properly can increase the chance of his survival. Now take an overview on doctor's ABCD. D for danger, R for response, S shout for help, A for airway, B for breathing, C for circulation and D for defibrillator. So friends, this is a healthcare video. You can share this video with your friends and family members so that They can also learn how to save the life of a person. Meet you soon in the next video inshallah. Stay tuned, keep watching and keep sporting.